Welcome to an introduction to ICD-10. My name is Chase.
And my name is Tia.
This short session presents an overview of the upcoming transition from ICD-9 to ICD-10. These are the agenda topics we will cover. Beginning with learning objectives and an overview, we will follow with how the change will impact your job and others at Happy Valley Medical Center. Finally, we'll close with a short review.
Here are the learning objectives for this lesson. Take a few moments to review them.
Let's start with an overview of ICD-10. ICD-10 is the 10th update to the International Statistical Classification of Diseases and Related Health Problems. ICD-10 is published and maintained by the World Health Organization. Beginning in October 2015, the Centers for Medicare and Medicaid Services, known as CMS, will require providers to submit all claims using ICD-10 codes. At its heart, the new classification provides more detailed information over its previous versions. The question you might be asking is, why do we need to change? We need to prepare as we approach the transition and for the long term that follows. Once the cutover happens, claims could be rejected by CMS and insurance companies if we aren't ready for the conversion. The revenue cycle could slow down after the transition. Some experts believe that, even in the best cases, effects of the change might be felt for more than a year.
America's healthcare system stands to reap significant benefits under the new classification system. The additional coding detail is expected to prevent duplication in procedures and testing while giving researchers better data. The United States is behind the rest of the world. Most other countries already use a version of ICD-10, and ICD-11 is already in development.
Our EHR system makes a preliminary encoding of the documentation for the encounter. However, it's a good idea for you to have a basic understanding of the code structure. In ICD-9, two pieces of information could be needed: a category representing a condition, disease, or symptom, and a single category modifier. The prior code composition was restricted to 3 to 5 characters. The first character was an alpha or numeric character, and the remaining ones were numeric only. After the transition, the number and complexity of codes and their modifiers increased significantly. The number of characters range from 3 to as many as 7. Digit 1 is an alpha character, digit 2 is a number, and digits 3 through 7 can be alpha or numeric characters.
Some codes will require additional information from the provider to determine the correct mapping. In the example shown here for spotting complications during pregnancy, the codes need information about the weeks in pregnancy. There are 3 ICD-10 options for the previous one. The determination will depend on the trimester during treatment. As seen here, the last digit of the ICD-10 code changes with the trimester.
Exactly where do the new coding details come from? Currently, ICD-9 codes describe the nature of the patient's chief complaint, or the what of the encounter. ICD-10 codes additionally describe the encounter's where, how, and chronicity. The charting examples here show changes in documentation needed to support the new contextual requirements.
Here is a charting example of a fracture. Mr. Joe Harper is seen in the emergency department after a fall from a ladder at home. Take a few moments to review the examples. The left example contains enough information for charge submissions today. On the right, I've italicized the additional information needed from you for the encounter to be processed. This level of detail benefits quality patient care. Providers can include the additional clinical elements now.
Keeping the previous case study in mind, let's look into the details. Notice the correlation between the level of detail and its related italicized text. Specific job aid and information for providers are available on the Happy Valley SharePoint site. CMS has published a subsection of materials for clinicians on their website. We encourage you to stay current by signing up for CMS email updates and following them on Twitter. Now that you are familiar with ICD-10, the next step for you is to complete training. Happy Valley will offer online, self-directed training at no cost to fulfill the 3 CME requirements for ICD-10. Refer to the SharePoint site for the vendors who have been selected to conduct training.
In review, it's time to think about and anticipate impacts to your department and workflows. Include a few minutes in each of your staff meetings to discuss your plans as we progress towards the October 2015 transition.
We appreciate you taking a few minutes to watch this presentation on the Introduction to ICD-10 and hope it will be helpful as you consider the upcoming transition. We want to hear your feedback. Send an email to training@hvmc.org or go to the Training Center to leave your comments or questions about this lesson.
Thanks for joining us.